Hi everyone, welcome to Let's Talk Oral Health by GAM. My name is Martijn and I'm joined as always by my co-host Rachel.
Hello, Martijn.
Hello Rachel. So today we are not broadcasting from our studio in our Swiss headquarters. We are broadcasting from Chicago because Chicago is the hometown of our American office. And we are joined here today by our special guest of today, which is Britt Glauz. Hello Britt.
Hi, Britt.
How are you doing?
Good, thank you.
Yeah, looking forward?
Yes, excited.
Wonderful.
Happy to have you with us.
It is. Many of our viewers may know you already, but still, would you maybe like to introduce yourself a little bit? Tell a little bit about who you are and what you do.
Yes, absolutely. So my name is Britt Glauz. I'm a clinical dental hygienist. I've been practicing for 5 years in the state of California. In addition to practicing clinical dental hygiene, I am the creator of BrushwithBritt, where I utilize social media platforms to advocate for dental hygienists and also for patients and for prevention.
And can you maybe tell us a little bit what sparked the project of BrushwithBritt? I mean, that's what you are known by most people. How long have you been doing it? What sparked it to start this initiative?
And also what it is exactly, because it's not just a podcast, It's more than that, right?
Yes. So I basically use all social media platforms and create content videos. And then I also have my podcast, and I've gotten into writing and speaking all as Brush with Britt, I guess you can say. And I started this in 2020. I was in dental hygiene school at the time, and my program got completely shut down. And so during that time, I started to think about my process in becoming a dental hygienist. And it was very all over the place. Like trying to gather information about how to become a dental hygienist was tough at the time. So when COVID hit, I had time, and that time allowed me to get creative and start creating social media content. So I initially just did it to spread awareness on going through community college to become a hygienist and that process. And then it built up from there. So now I've been a total of 5 years just creating Brush with Britt.
And it took you to how large should I think in terms of size of your following? Out of curiosity.
Yeah, so TikTok is 150,000, Instagram is 100,000, and then my other platforms are a little bit smaller than that.
An impressive career in the sense that you said you have been a dental hygienist for 5 years, that you have developed this brush with platform, but you are also actually the 2023 GAN RDH Award of Distinction recipient. And after that, in 2024, you won the World Dental Hygienist Awards, organized by the Sunstar Foundation in the new RDH category, if I'm correct, right?
Yes.
So impressive career path for such young an age.
Yes, thank you. I appreciate that. It definitely was monumental receiving those awards and getting that acknowledgement.
Yeah, we actually met for the first time, of course, in Seoul when we were celebrating the World Dental Hygienist Award and the fact that you won. So can you maybe tell us a little bit what it did for your career or for your personal development, or how you felt about winning the awards?
Yeah, so initially starting out, you're creating this content, you're doing all of this work and making the podcasts. And I feel like initially it's just the acknowledgement of all the work that was behind everything that I've been doing. And then for there to be a new graduate category was really valuable to me as well, because it showed me that I do have the ability to create change in this field early on. And receiving the awards and all the things that come with it was incredible. But I think the number one thing that I received from it was the connections that I was able to make with other hygienists that have 30, 40, 50 years of experience. And then to the world hygienists, being able to meet and connect with hygienists from all around the world.
Yeah, that really marks a very steep evolvement in your own career. But the profession of dental hygiene is also evolving, but the role has been changing. And how do you see that change happening during your career so far?
Yeah, just within the past 5 years, I feel like we have a more significant focus on prevention itself and how we can elevate that to its fullest ability. So I've been seeing things like not all of these things are brand new, but they are being implemented more frequently. So things like salivary testing, so taking a sample of a patient's saliva and finding out what bacteria is there and how much of it is there. and then taking that bacteria and seeing what systemic links it has, and things like using a microscope or guided biofilm therapy, even doing things like glucose testing in the operatory and being able to administer Botox for TMJ purposes. So it's gone a long way just in 5 years.
Yeah. And during your podcasts and articles and content that you produce, you talk about different preventative care models. Can you maybe share us a little bit more about those and how you've been applying them in your daily practice?
There's definitely a lot out there, but I think the one that I like to focus on quite a bit is hygienist-owned practices. So it's not that we are separating ourselves completely or like detaching ourselves from dentists, but it's more so we are putting prevention and hygiene in one roof and then being able to refer out restorative and even other medical things as well. So there are certain states where hygienists can actually own their own brick and mortar practices and like things like mobile vans and affordable dentistry. In addition to that, we also see more less invasive dentistry. So when it comes to things like monitoring decay, there are things that we have that can actually remineralize those areas before actually having to like place a restoration. So I'm seeing that be used in the operatory more frequently as well, like things like silver diamine fluoride.
You were talking about the oral systemic link just before with all the new approach of prevention. And how do you see, because we know that there is a lot of information and knowledge recently on the oral systemic link with oral health having an impact on chronic diseases like diabetes, cardiovascular disease. And recently, actually, we learned also a new research field on the impact of oral health on psoriasis. So all this knowledge is great, but how do you see that knowledge be put in practice by dental hygienists?
I think in the current state of things, it is difficult with the way practices are ran, but there are ways to be able to implement it. And I think that it starts really with going back to the basics of reviewing, doing a thorough medical history review and actually talking to the patient about what kind of medications they're taking, their history of smoking, alcohol consumption. So really starting with that assessment, and then you're doing your things like your hypertension screenings and your oral cancer screenings. So those are things that are all preventative and start right at the very beginning of the appointment. So I think initially it starts there.
And is it achievable for dental hygienists in the current way they work? Or would they need additional support from whatever authority or company or more time, more funding? I don't know.
Yeah, I think with those initial screenings and assessments, like that's vital to a preventative visit, and there's enough time in an appointment to do those things. Absolutely.
Okay. Looking forward in time, I mean, we talked about how the role of a hygienist is changing, and now more and more this connection of the body and the mouth is being integrated into a hygienist's responsibilities. How do you see the future going into that direction? Do you foresee any further evolvement or?
Yeah, I think that there will be more medical dental integration, and there is a place for dental hygienists to end up or be in hospitals and schools, nursing homes, OBGYN offices also. So usually when I make those references, people are like, why would there be a hygienist at an OBGYN office? But there are hygienists out there that are already doing these things, and it all starts with prevention. So if you have a expecting mother come in, I mean, it could even be before. It could be just the idea of wanting to start a family, and you start with those. You start there. But if it's that initial visit, you can already start talking to them about the oral systemic link there, about their own periodontal disease, because periodontal disease is linked to things like low birth weight and outcomes. And then you can also be early to talk to them about what to expect when the child does arrive, and things like the way the mouth develops, and not sharing utensils to not share the bacteria. There are so many things that you can go over before the baby even arrives. So that's a hygienist could be in an OBGYN office and utilize one of those visits to educate the parents.
Is that already happening?
I have talked to one hygienist. I can't remember what state she was in, but yeah, she talked to me about that role, and it was a part-time position that she has, and she just goes in during, I think they do like a glucose test or something during pregnancy, and there's like a waiting period that you have to wait, and during that time, she would go in and she would talk to the parents about oral systemic health.
That's great. Yeah, I think we'll touch more about it on the interdisciplinary approach later, but I think it's fantastic, and you see more and more this trend also in Europe, for example, where you have these, at least a vision of having a practice where you combine all different medical specialists and also integrate oral health in that. So, but we'll talk about that at a later point, because I wanted to go back to the point of prevention, not even talking about the oral systemic link, but really on prevention itself. It's a world where you as a hygienist, you operate in all day, but for a patient, maybe it's not that obvious. So how do you convey the message of the importance of prevention to that patient?
I think it all just starts with like smaller steps first. I don't like to overwhelm patients with these very complex conversations. So just letting them know that we are there to prevent disease and we don't want to wait for something to happen. So that is why we might do more frequent cleanings, or that's why I might recommend a certain toothpaste or a certain product. But I try to kind of avoid having very complex conversations and just letting them know that we want to be there before a problem starts and not wait for a problem to start and then have to treat it.
Do you find any misconception before even you start explaining education to patients? Do you have already experienced misconception about prevention with your patients?
Yeah, absolutely. I mean, it first starts with, usually it's blood pressure, right? So like we're doing the hypertension screening and then they're like, why do you have to do that at the dental office? Like, what's the point, you know? And it's not that I'm just checking it just because, or I'm looking for high blood pressure. It's a screening. So I think that that's the part that it initially sparks that conversation of like, what do you mean? Like, what do you mean a screening, right? And the same thing with an oral cancer screening. We're just looking at everything before so we can make sure we try to catch things early.
Yeah. Do you have a real life example of a patient who, after a consultation with you or after a few sessions, really understood the value of prevention?
Yeah, and honestly, my example is with blood pressure in dental hygiene school. That's one of the first things that we learn how to do is check blood pressure. And I had a patient come in and you have to check it every visit for them. And so you're kind of sitting there like hoping that it's in a good range, because if it's high, you have to dismiss them and then like you lose points for the day. So you're always hoping their blood pressure is good. But I had a patient that came in and hers was through the roof. And so you have to provide them with a medical clearance so that they go get seen by a doctor. And she actually went ahead and she did it, and she came back and she was so thankful for the screening because she had no clue. Like there was nothing else on her medical history, no medications, no nothing.
Right.
So she had not a clue that her blood pressure was high, and she was able to get diagnosed, get medication for it, and then she even made lifestyle changes and ultimately was able to completely stop taking medication and have her blood pressure in a good range.
So it all started with a very straightforward blood pressure measurement.
Yeah, and that's happened to me multiple times in 5 years with just blood pressure alone.
I think if you reflect back on that, it was the core of that success. Was it that you from the beginning started to build a relationship with the patient based on trust, and that they really value what you're doing for them?
Mm-hmm, absolutely. And then you feel like, wow, just by providing them with that screening that maybe took a minute, like I potentially, helped to save her life, because if she is walking around with that, she could have a heart attack.
And that's a success story, but of course, every hygienist will probably agree that sometimes it's not that easy. And part of the challenge is, of course, that every patient responds different to your approach, right? Every patient needs a different approach. Somebody might need, the empathy and a warm chat, and get a personal touch with professional, whereas others maybe just come in and looking for a solution, just saying, okay, help me, I'm in pain, I have an issue, help me out. That's all I'm looking for. So how do you work with that? How do you make sure that you have the right approach for each patient?
I always try my best to read the patient as best as I can. There are cues and we get vibes and things like that from our patients. So I always try to feel how they are feeling during the visit. And I don't expect every patient to come in and be so excited to learn how to floss. I know that there are going to be differences, and sometimes patients have a bad day too. Like there are so many things outside of a dental visit. So I'm always trying to kind of gauge where they're at. And I like to start small. So I'm not going to throw every oral hygiene instruction that I know at you in one visit, but I might focus on one for the day and do that tip with you. And it might even be focusing on a certain area. So being very like goal specific, but a goal that is achievable. Because then I like to celebrate wins, right? So if I have a patient come in, I might focus on one area and then go over oral hygiene instruction for that spot. And then if they come back and it's better, it feels like a win and an accomplishment for them. And then they might be excited to fix another area or go to the next step.
Okay. I was going to ask about how do you deal with your time efficiently? Because you said you have time with the patient, but still it's quite limited. So how do you deal efficiently? But you're saying take small steps and take a gradual, progressive approach with achieving goals.
Yeah, I think when you'll be able to also figure out how much your patient can handle. Some patients will want to know like 5 tips in one visit, and some one is enough, and they're good. But it definitely is you have to manage your time in dental hygiene. It's constantly a struggle because there's always the clock is ticking for every appointment. So it is a challenge to navigate.
But I would like to ask you though, some patients, I said, you have different profiles of patients and different personalities, and some might be resistant or reluctant. How do you deal with this profile of patients? Resistant to a prevention and to the advice that you might give them.
Mm-hmm. I think a lot of it comes back to just education and how you speak to the patient, and if you're able to get through to them on something that's relatable. So I always like to use things like analogies because I feel like they're just make it easier to understand. So sometimes I use that or photos. Photos do a really good job to show a patient like, hey, this is what's actually going on, because a lot of times we don't look in our own mouth. Right. So I try different techniques or visuals like brochures and things like that to show the patient different things. But sometimes you have to have small steps with patients that are resistant.
Yeah, we talked about the oral systemic link. Can you also leverage that from the perspective of connecting with the patient? Well, you mentioned already blood pressure, so that's already one example, but do you maybe have more examples where educating or explaining the importance of your oral health for the rest of your body can sort of help building this relationship with the patient and pointing to the importance of oral hygiene?
Yeah, I think I always like to say the bacteria in your mouth has also been found in places like your brain and your heart. And that right there is like a pretty big eye-opener for patients to be like, wait, really? Like, I didn't know that this was connected to everything else, but that's kind of where I always like to start and go from there.
Because that's actually the next topic of our conversation is we talked about the oral systemic link from your perspective purely and in your relationship with the patient, but it goes beyond that, and you also need to work together closely with other professionals outside of dentistry field, so with medical professionals. So how do you approach that? I don't know how exactly it works in the States, but is there a close collaboration between dentistry and medicine?
I would say no. We're very much separated. Like, I think that has also made us feel like they are disconnected because medical is so separated from dental. So there is that disconnection there. But it could be something as easy as writing a summary to that patient's doctor or having a phone call with the patient's doctor. But it definitely is, I would say, a bit of a challenge to kind of bridge that gap.
And do you have an example of your own practice that you really improved a patient's health thanks to a collaborative work with a physician?
Yeah, so I had a patient that came in, they had a lesion on their lip, and it was something that wasn't healing, and it had been there for over 6 months. And I let them know, like, I'm concerned about this. This spot is not healing. It had irregular borders. And they said, oh, well, I have an appointment in a few months to see the dermatologist. And I said, this actually concerns me, and I think you should try to get in there sooner. So I actually had a phone call with the dermatologist to help expedite that appointment to get them in sooner, and it ended up being skin cancer. And the patient's fine now, recovered, but they had to have that entire spot removed. So something as simple as that, it definitely goes a long way.
I remember from working myself at the time with family physicians, and I experienced, to be fair, some resistance in trying to bridge the gap between medicine and dentistry. Sometimes I felt like I'm a lobbyist for dentistry, selling my own story, whereas they may perceive it differently. And I can imagine that sort of barrier is everywhere when we try to bridge the gap between dentistry and medicine. So do you have any tips or any thoughts on how to break down those barriers and bring the two disciplines together? Is it a simple matter of putting them together in one room and let them talk it out, or what are your thoughts on those barriers and how to break them?
I think in dentistry, we have to start all different dental professionals, dentists, hygienists, periodontists, everybody has to start making our presence known in these places, like conferences that aren't just dental conferences. Like we need to go to medical conferences. And I actually went to one, it had over 12,000 attendees, and there was 2 to 3 hygienists there and a couple of dentists there, so I think we have to really start being the ones to get out there and be the voice for not only our profession, but most importantly for our patients.
Yeah. And the other way around, do you also see that it would be great to have medical professionals coming to dental conferences, dental conferences?
Absolutely.
Yeah.
That'd be amazing.
Yeah. And in terms of policy and guidelines, is there anything in place in the US that brings two together? I know, for example, in diabetes care, from where I live in the Netherlands, there are a few sentences where it's recommended for diabetes care professionals to be mindful of periodontal health and refer to a periodontist or a dentist if it's necessary. Not that many people abide to those guidelines, but it's at least it's in there. How's that in the United States? Is there something in policy or in guidelines as well?
I think the only thing I've seen like recently is in medical offices being able to apply like a fluoride varnish. Some insurances have been starting to cover salivary testing. So little things, but it's not a big enough jump that we need.
So that incentive is not really there yet.
Even for diabetic patients?
Not that I'm aware of. Some of them, sometimes you can get extra coverage for an additional cleaning for certain systemic conditions, but it's definitely difficult.
And can you refer, as an ORCA professional, as a hygienist or dentist, can you refer patients to a GP, to a family physician, or?
You can, but I would say it's pretty rare.
Really common.
Yeah, like we might give them a generalized like medical clearance, and they can kind of just take it wherever they want to go. So it's kind of hit or miss.
I think there is more or less the same patterns in Europe. So it's not that much different from all across the world. So, well, a completely different topic, but that's something that's really close to your heart, is social media. As we already mentioned very briefly in the introduction, you're a native to social media. Your BrushwithBritt initiative it's living on social media, so it's a big part of your life. How do you think it has changed the way patients and people in general think about oral health and prevention?
I think that it's done a lot of positive, and that it's made it relatable and accessible. Right. So I think before social media, there's some information online, but most of the time you have to go to an actual dental office to learn any type of information. But now we have creators all over, talking about the C-shaped flossing technique, how to use all these different oral hygiene aids. So I think that it's done a great job of normalizing it. Yeah. Like it's not something that we have to be so afraid of, and it's important for our overall health.
Are all the platforms similar, or are some platforms more used than others by the dental hygienists?
I would say probably Instagram and TikTok are the most used, in my opinion.
What kind of content connects most the oral care professionals and the patients?
I think things that are educational and fun, and probably have a little bit of humor in it, make it more engaging and more like patient friendly.
Yeah.
Among all these platforms, which one do you think for a dental hygienist who would like to start social media, which one would you recommend first?
I would say I would probably start with Instagram first. If I were to, have to start everything all over again, I'd probably start with Instagram, but also TikTok, the way that it works, the algorithm, it is very favorable to being able to grow quickly, harder to grow on Instagram. But I think, I'd probably start with Instagram.
Who are you mostly connecting with? Is it because you publish and generate a lot of content? Is it mostly for oral care professionals or for patients?
I'd say mine is more so dental professionals with like a little bit of patient care sprinkled in.
Yeah.
So it's a bit of both, yeah.
So the majority of your following and the ones you engage with is with a hygienist.
Yeah, dental professionals in general. I do have a lot of assistants there as well, some dentists as well too.
Yeah. So in that sense, it's also a way to connect with your peers, but also to educate them where necessary. So it's not necessarily a platform where you would educate your patients, but it's also to, educate and connect with your peers.
Yeah, absolutely. You can obviously take it whatever direction you would want to go in, but mine is kind of a little bit of both.
Well, you already mentioned the educational and the more entertaining stuff. How do you make a nice balance between purely educational and showing examples of your own life, and also the sponsored content? Because most people know for the influencers, sponsored content is also an important part of their content. How do you balance those two?
I think for me, it's being authentic to the things that I actually use in clinical practice, promoting things that are research-based and they're backed by research and not just, in brand new product, nothing has been done with it. But really staying true to my platform and knowing that the things that I'm talking about, I actually like,
Right.
I use, and I love. I think if it wasn't that way, it would be very difficult to promote product. And that's really like how you end up building your brand is by promoting things that you truly believe in.
Yeah. How do you see the future of social media in dentistry?
I see it kind of following the beauty community. So I feel right now we are very behind in that sense. And I do see it kind of going more in that direction and having things like branded sponsored events and, a whole group of creators, because we already have that. There's a big group of creators in all different dental professional categories. So I see it growing to being more towards the beauty industry.
So, but besides your work on social media, you still are active in practice. We talked, of course, about the importance of prevention. What are your recommendations or ideas about building a prevention-focused practice?
I know that there are a lot of dental offices that are already out there running and everything. So I feel that it can even start with a simple thing as implementing blood pressure, which I know I've brought that up so many times, but there are so many offices out there that are not doing it. And that in itself is starting that ball rolling on prevention, and making sure that you are implementing things like the oral cancer screenings as well. That's another thing that I think a lot of it gets missed, and just being able to start with that small step is definitely an achievable goal, and kind of building up from there.
Yeah, so these prevention-focused practices already operate, I imagine, in the US.
I mean, there are, do you mean like hygiene-owned practices? Yeah. Oh yeah, there are hygiene-owned practices already in the United States and in certain states, and you can really implement, if you're starting your own practice, you can implement anything. So, I mean, if I were starting my own, I would have the salivary testing, the guided biofilm therapy, go over, nutrition counseling, and also having the oral hygiene aids that I'm recommending in office so that the patient can leave with them instead of having to outsource and buy them somewhere else.
Would you say it's challenging for a hygienist to start a practice like that, or to work in a practice like that?
Yeah, I would say it's definitely a challenge. It's not impossible. There are hygienists doing it, but just the way everything is structured, there are a lot of barriers for us that make it difficult. And in order to be profitable, you also have to put in a lot of work for that.
No, yeah.
Mm-hmm.
what would be the first mistake that people do when they want to shift the practice toward a more prevention-focused dental office? What is the first mistake that they do?
I think a lot of offices focus on a regular recall schedule. So they're just telling patients 6 months, 6 months, 6 months. And then they use this narrative that hygiene isn't profitable, but that is when gum disease isn't being properly assessed and treated. So I think that's the first misconception. It's not just about numbers. Like you can't just, that's not going to be long term, that's not going to be profitable. It's more about quality, comprehensive care for our patients. And ultimately, you're building trust and then retention. And that is what will build a profitable practice.
So it's tailoring your care also to the patient needs.
Yes. And not just everything is, one way for every single patient. Oh, 6 months, 6 months. We really have to be looking at all the different risk factors for our patients, and individualized care, it should really be the focus.
Yeah. Now, it's interesting because already a few years ago, the WHO put a big focus, as an example, put a big focus on the importance of prevention. So it's not a very new concept and it's gaining traction. But I also feel sometimes there's a big misconception of how to make prevention profitable and make it worth opening a practice for. So how do you see those misconceptions? What are
I think in the current landscape of things, we can be profitable by, like I said, properly assessing and treating gum disease, but there is a lot of other things that need to change to make it better. So right now, everything is kind of bundled into one fee. So everything that we're doing, the hypertension screening, the oral cancer, nutrition, OHI, all of that stuff is in one fee. And that fee is really only just covering the scaling part of what we do. So really starting to break that down and being able to get reimbursed for the actual
what you're actually doing.
what we're actually doing would be a start. And then in addition to that, using things like the SDF, which helps to or arrest decay, or there's other products out there that can remineralize decay. Like there are a lot of things that we're not utilizing right now in the prevention category that we can add to that reimbursement list.
No, I was thinking one of the more recent trends that you see in the US, and I think more or less similar also in Europe, is this rise of the DSOs, so the dental support organizations. Do you see that that's helping with what you're achieving with the whole prevention approach practice, or is it working against that trend?
I think there is good and bad in both, and there is room for a DSO to really focus on prevention and elevate that rather than just focusing on profit and production. So I think that they can definitely enter the field and make a difference in prevention if they tackle it the right way.
You see that happening in all truthfulness?
Maybe a little bit.
Yeah.
So we just discussed about the DSO, but however, I just would like to ask you to define a bit what DSO is, because not everybody knows what DSO, the dental support organizations, are. Maybe it's on the rise in Europe, but not everywhere. I don't know. So could you just explain to us how they work actually, what it is exactly, and how they work?
Yeah, so DSO is an organization that basically buys out different dental practices and owns them and manages them. So handling all the financing and all of that. And so in the US, there is privately owned offices, which is usually owned by a dentist. And then you have these DSOs, which own multiple offices. And each office probably runs pretty similar or has similar protocols. And so they're really basically like the owner of all of these different dental practices, not the dentist owning the practices.
I think in Europe we would call them chains, like dental chains. Yeah. It sounds like that they can improve the efficiency of a dental office in that sense, in terms of administration, buying of software.
Yeah, they can. And that's why I always say that there is positive there, because within a DSO, I did work for one, and I had a positive experience in the sense that I did learn a lot about production and the business side of dentistry.
Yeah.
And as a hygienist, I think that that's incredibly important for us to learn about
Yep.
because it empowers us as a clinician to be able to advocate for the things that we need. So if you're working in a DSO, you learn about the numbers, you see what you're bringing into that practice. It might allow you to advocate for the instruments that you need or, things in the operatory that might actually elevate patient care.
To use it to your advantage.
Yes, yeah, absolutely. And even with, having to see a lot of patients, if you're able to implement a periodontal therapy program in the practice and you see those numbers rise, you could potentially lessen the amount of patients that you're seeing because you're hitting your production goals.
Yeah, people in Europe also talk about these chains as something very negative, but it sounds like you can turn it into your benefit, definitely.
Yeah, I think both private practices and corporate practices, they both have good and bad in both.
Yeah.
It all depends on the leadership.
Staying on this more organizational and financial element of being a hygienist and building a practice and operating in the field specifically to the US, you've also been a very strong voice and a very strong advocate of the fact that the dental insurance system that is currently applicable in the US doesn't really live up to the standards and to the needs of the patient anymore. Could you maybe share a little bit of that voice and about your perspective on that?
Yeah, absolutely. So in the United States, reimbursement rates for prevention services, some of them haven't gone up since the 1970s. So you have a hygienist working in 2025, with an hourly rate of whatever, but the reimbursement rate for the cleaning that they're providing the patient with is still arranged, hasn't changed since the 1970s. So that's where the big discrepancy is coming from. And it also is not following all of the things that we do now in an appointment, right? Like we were breaking down that appointment. So, all of those things might not have been in that prophylaxis appointment back in the 1970s. Right. So that's one thing. And most dental insurances only give you $1,500 to $2,000, maybe $2,500 if you're lucky, for the entire year. So if you have a patient that comes in and they need a deep cleaning, they need a crown, they need a root canal, you might be able to get one of those things done. Right. And then you don't have any more coverage. You're maxed out for the rest of the year and you can't get anything done. So there's definitely room for dental insurance reform.
And what kind of changes do you see to better support prevention and dental hygienists in general?
I think the first thing would be those reimbursement rates and starting to add additional codes for all of the things that we do, and increase the fees for all of the different types of cleanings that we do, and also the maximum amount that patients get per year is just, it's not enough in today's world. So increasing all of those things, and ultimately prevention will save money. So I think that
there's enough evidence for that even in research. I mean, it's pretty obvious.
Yes, and with the prophylaxis cleanings too, those are generally 2 per calendar year. I don't know where that number came from or where that was set, but it should really be based on the patient and the systemic conditions that they have and your risk factors, not just everybody gets 2.
No.
Yeah.
It's interesting that you mentioned that this gap starts to form because people can afford, because usually the people who cannot afford these preventative treatments, they are the ones who need them the most. So I would say that system sort of reinforces the gap that is existing between people who can afford prevention and those who cannot but need it.
Mm-hmm. It's definitely flawed.
But do you see an improvement or an evolution?
I haven't seen very much change, honestly, in 5 years. And even before that, I was a dental assistant prior to that for 8 years, and there has been like little to no change. There might be some of the insurances that increased their fees, but it's very, very minimal.
Do you think this current system favors treatment over prevention?
Oh, yeah. Absolutely. Yeah, there's not a focus on prevention in the current system. It's all just based off of being reactive.
Yeah, because we talked a lot about how to make the practice more more prevention oriented, make a hygienist more prevention minded, or be able to be more prevention minded. Do you think this insurance landscape is really blocking that movement?
Absolutely.
So changes are needed. Yeah, and so in Europe we have a slightly different system, I would say. We have a lot of social insurance that cover the basics. Do you see those trends start popping up in the United States as well?
Yeah, possibly. And I think too, a lot of patients are starting to value prevention. And if you can get to that point that you are just preventing disease, now it's almost like cheaper to pay out of pocket than it is to have dental insurance. If you can stay in the prevention category and not need treatment, it's almost better.
But that needs a lot of awareness for the patients. So they would need to be educated and be made aware of that principle.
Going back to prevention, education of prevention. I mean.
Yeah. So we talked a little bit about the role of hygienist in the mouth-body connection. We talked about the importance of prevention. If you would look ahead, what change would most strengthen the role of a hygienist in the future?
I think if we initially start with acknowledging that we are healthcare providers and we are prevention specialists, and then also just all over the United States advancing our scope and allowing us to do the things that we are educated on and licensed to do outside of a dental office. Of course, that role in a dental office is important, but if we could have the autonomy to practice in these places like hospitals and schools, that would definitely help to expand our reach and be able to get to more patients early with prevention.
And what type of treatment or what type of things that you would like to do, you're not allowed or you're not really enforced to do now?
Most things. So, just providing patients with x-rays and the different types of cleanings and even things like local anesthetic. Being able to have your own hygiene practice, if you want to do that, have to be able to practice without a dentist being physically there. So right now it really feels like prevention is kind of being gate kept and it's locked in just a dental office. But in order to expand outside of that, we have to have the autonomy to be able to do it.
And where does this resistance come from?
I think just the way everything has been structured, and right now a lot of what we do is controlled by dentists and we really are a separate profession. So while we need to be kind of detached or separate the two roles, we still very much need to work in collaboration with each other.
So with the dentist, but coming back to what we were saying at the beginning, also with the physician. So there is really a triangle of collaboration between all the disciplines.
Yeah, absolutely. So we would be able to refer to a dentist for restorative treatment. We could work in underserved areas and also provide patients with referrals to maybe like a medical doctor. So just being able to get to more patients and increase access to care.
It sounds like a very weird is maybe not the right term, but in lack of a better one, a very weird situation where I feel there's a very strong advocacy from within the dental hygiene field to become more independent and gain more autonomy. Whereas on the other hand, what I learned in the United States is that the assistants also get more and more liberty is not the right term, but they can do more, start to do more and more. The scope of work of the hygienist. So how do those two movements go hand in hand? From the one side, there's the resistance in the hygienist becoming, more independent and doing a wider scope of work, whereas for the assistants, this seems to be opening up. How does a dynamic work?
I think a lot of that is financially driven. As a previous dental assistant of 8 years, you don't know what you don't know. And I thought, I'll be a hygienist. This is so easy. And I didn't know anything about, the body, the oral systemic connection. And so going through that experience and knowing what I know now as a hygienist, I know that prevention cannot be taught in a weekend course or even like a week course. So unfortunately, I think a lot of that comes just from being financially driven and ultimately keeping our role as hygienists kind of locked in and not allowing us to be independent and autonomous.
Funnily, because you're of course operating in the United States, but you see exactly the same movements in Europe as well, where there's also a strong fight for a wider scope of work among European hygienists and more autonomy. So it's funny that even though you're separated so much and the care systems are totally different, the advocacy for a more independent, more autonomous, more wider scope of work type of hygienist, it's a global movement almost.
Wow, I didn't even know that.
Yeah.
Yeah, and even if we just started with the basics of what we went to school for, what we're educated on and licensed to do, starting with the assessment and treatment of gum disease, taking x-rays, there is no reason why we shouldn't be able to do that in other settings.
So I think we've come to an end of our conversation. It was very interesting to hearing your perspective on the role of a dental hygienist, and the future as well of the dental hygiene field. I think you're a very strong voice in that movement. So it was a pleasure having you and listening to you on this show.
Yeah, and thank you for bringing a different perspective, because it's not necessarily the type of conversation that we've had until now in our podcast series. So it was very interesting, listening a lot to really get this perspective and your angle. So thank you for being with us.
Thank you. Thank you so much.
I hope you also enjoyed it.
Yes, I did. Yes.
Very good.
Thank you for having me.
And thank you also for the audience for tuning in again. If you're interested, we have a lot of other very interesting educational videos on our YouTube channel, so go check them out. You can also listen to them as a podcast on Spotify and on Apple Podcasts. So I hope you enjoyed it. Again, thank you, Britt. Thank you, Rachel. And we'll see you all next time.